October is Breast Cancer Awareness Month, and we are joined today by an expert in the field, Dr. Stephen Quay, CEO of Atossa Therapeutics. Dr. Quay has 7 FDA-approved pharmaceuticals, 87 U.S. patents, and recently delivered a TED Talk titled How to Be Smart When You're Dense, Preventing Breast Cancer by 2030. We are so glad to have him with us, especially this month and this time. Dr. Quay, good morning. Thank you for joining us.
Good morning. Great to be here, Danny.
Thank you. So, Dr. Quay, your TED Talk title, I just read it, indicated a lot of your work in breast cancer prevention is focused on breast density. Can you walk us through what that means and why that's a key issue?
Absolutely. Just like the pap smear doesn't find cancer, but it finds the pre-cancer that takes 10 years to develop into cancer, the density a woman has on a mammogram is predictive of future cancer. So when you have a mammogram, if you don't have a lesion that they want to biopsy, that's a good thing. And then if you have high density, you need to be a little more concerned about being in a category that has about a 5 to 6-fold increase future breast cancer.
So let's say that you are a woman or maybe a man who finds yourself in that higher risk category because of density, like you just said. What would you do from there?
Yeah, so Atossa Therapeutics is developing pharmaceuticals that will address that in the future. But currently, the key element for a woman to lower her density, lower her risk of cancer, is to lower her estrogen. And there's really 3 lifestyle changes that can lower it about 20%. Getting more exercise. So you're building muscle, you're actually balancing a little more testosterone, a little less estrogen. That's number 1. Number 2 is being sure that you don't drink too much, because alcohol causes the liver to increase estrogen. And the third is getting a very high vegetable fiber diet, because meats tend to increase estrogen in women. So if you can do those 3 things, you can get a head start on being able to lower your risk if you are high risk.
This is so fascinating. I haven't heard any of these things before. So if that's how you keep density down, doctor, where would you go from there for the rest of your life?
Sure. Well, the density is measured on a mammogram, which usually starts at 40 for women, maybe 35 if she has some risk factors. But about 1 in 4 will be in the high density group, and they're the ones you really want to pay attention to. So the key things are to do these lifestyle changes. The self breast exam once a month for a woman to learn to know the feeling of her breast. So if she finds something unusual, about 1/3 of cancers are found by a woman doing a self-exam in the shower, getting your mammograms, and eating and living properly.
Doctor, what about for men? Can they also give themselves those exams, and should they be as cognizant about their density?
Well, look, men have 1% of the cells in the breast that women do, and guess what? They get 1% of the cancers. So while women will get about 300,000, 1 every 15 seconds in the U.S. This year, men get about 3,000. Still something to watch out for, but it's typically, they'll notice that their nipples are bleeding, and that's pretty shocking for a man or for anyone, and that takes them to the doctor. It's so low for men, it really isn't something you should surveil around.
Okay, but thank you for telling us about the bleeding nipples. That's good to know. So at least there's one sign you can look out for. Doctor,
Right.
I learned a lot in the last 4 minutes. Thank you so much for joining us today. We appreciate it.
Thank you. Thank you very much, Danny.
Absolutely. And everyone, some really enlightening and important information there for you. Breast cancer awareness year-round, not just in October. And for more information, you can go to Dr. Quay, drquay.com. We'll have that link for you on our website, daytimeonline.tv as well. And we'll be right back.